Welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the day or topic for the session is Family Health Nursing Process. Family Health Nursing Process. I have already uploaded a video of Community Health Nursing Process. If you have not watched that particular video, you can watch that video first because there are some similarities and some difference between Community Health Nursing Process and Family Health Nursing Process. By watching both of these videos, you can differentiate and you can understand in depth and in detail about the family health nursing process and community health nursing process. In this video, it is included introduction of family health nursing process, definition of family health nursing process, phases of general nursing process and comparison with the elements of family nursing process, which includes family assessment, family diagnosis, planning, implementation and evaluation of family nursing process. So let us discuss about family nursing process. Nursing process is a systematic method for organizing and delivering the nursing care services to the public or to the person. So nursing process is a systematic, scientifically proved method or approach for organizing and rendering various nursing services to the individual, to the family or to the community. Thus, family nursing process can be applied to either to individual or to the family or in total to the community. So when it is applied to the individual, it is known as nursing process, general nursing process. And when it is applied to the total family members, it is called as family nursing process. When it is applied to all the people, all the families of a particular community, then it is called as community health nursing process. That means nursing process can be applied to individual, family and even to community. The whole community. Then steps of family health nursing process and the community health nursing process are somehow same. Steps are same, but there are some variations, some differences in nursing diagnosis, implementation of that health services and evaluation of health services. So the steps are almost same between family health nursing process and community health nursing process, but there are some variations. There are some changes in nursing diagnosis, implementation and evaluation. Family nursing process is the systematic steps to analyze family health problems and their solutions. So family nursing process is the systematic steps or systematic approach or scientific steps to analyze, to understand the various family health problems of the family members and to render the services to solve such problems or needs of the family and their solutions. Thus, the family nursing process is the systematic steps to analyze the family health problems or needs and for their solution. Then family nursing process helps in achieving the desired goals of health promotion, prevention of diseases and control of various family health problems. So family health nursing process also helps to achieve the desired goals or outcome for the family as rendering the health services for the health promotion of the family members, prevention of various communicable and non-communicable diseases that affects in the family and thus control the various family health problems. Next is definition of family nursing process. Definition. Family nursing process is a problem solving process or it is a problem solving approach. So there are many approaches in rendering services in community health nursing. In that one approach is problem solving approach or problem solving process. So family nursing process comes under a problem solving approach or process that addresses family health problems, that find out various family health problems at every aggregate level, the maximum level of understanding about the family problems of the family members with the goals of preventing illness and promoting total family health. So family nursing process is a problem solving process or approach that addresses family health problems in detail, that is at every aggregate level with the goals of preventing illness and promoting family health. The goals of family nursing process are prevention of illness that affects the family members and thus to promote the health of all the family members, that is optimum health or maximum health. So family nursing process is a problem solving process or approach that addresses family health problems at every aggregate level with the goals of preventing illness and promoting family health. The second definition says family health nursing process is an orderly, systematic step by step, systematic, a series of steps orderly, systematic steps for assessing family health status, family health problems. Then diagnosing family health care needs. So that is family diagnosis. Then formulation of plan for care. That is planning of the various interventions for the planning various action plans or strategies to render the services to the family members, then implementing that strategies or the plan and evaluating the final evaluation of the effectiveness of all the implementation what has been done during the family nursing process to achieve the family health or total or optimum family health. So the second definition is family health nursing process is an orderly, systematic steps for assessing family health status, diagnosing family health care needs, formulating a plan for care, implementing the plan and evaluating the effectiveness of the services to achieve family health. The third definition of family health nursing process is family health nursing process is a systematic problem solving logical and deliberate process. So it is a systematic, it is a problem solving, it is a logical and intellectual, logical and deliberate process, a series of steps to help the family to develop and strengthen their own capacities, which help the families to develop and strengthen their own capacities to meet their own health needs, and to solve their health problems. So it is for the family and by the family. That is family health nursing process is a systematic, problem solving, logical and deliberate process to help family members or to help family to develop and strengthen their capabilities, their capacities to meet their own health needs, and to solve their own health problems, So the last definition is family health nursing process is a systematic, problem solving, logical and deliberate process to help family to develop and strengthen their capabilities to meet their health needs and to solve their health problems. So these are the three different definitions. You can learn at least one definition with the complete meaning. Next is the steps of nursing process. So this is the general steps of nursing process. That is assessment phase, planning phase, action phase and the evaluation phase. This all I have been explained in detail and in depth in community health nursing process video. You can go through that. So steps of nursing process, there are mainly 4 steps. That is assessment phase, planning phase, action phase or implementation phase and last phase is evaluation phase. In today's video, we discuss in detail and in depth about the elements of family health nursing process, components of family health nursing process. There are 5 elements of family health nursing process or components of family health nursing process, such as first step is assessment of client's problems. That is family assessment. So assessment of client's problems or that is problems of all the members of the family. That is family assessment. Second element is family diagnosis. So diagnosis of the problems of all the family members. That is family diagnosis. Then third element or component is planning of client's care. Planning of family members care. That is making different interventions or strategies. That is planning of client's care or family members care. And fourth step is implementation of the care which is already planned. Implementation of care of the family members. The last component or fifth component is evaluation of the success of implemented care to the family members. So evaluation of the success of implemented care to the family members. So elements or components of family health nursing process includes family assessment, that is assessment of client's problems, family diagnosis, that is diagnosis of various problems of the family members, then planning of clients or family members care, that is intervention, then implementation of the planned care, that is implementation of the care of family members. The last component is evaluation of the success that is achieved after implementation of the care. So evaluation of the success of implemented care to the family members. So let us discuss in detail about the elements of family health nursing process in this video. So the first component is assessment of client's problems or family members problems. That is nothing but family assessment. Assessment of client's problems or family members problems are systematic collection of data of family members. So it is a systematic collection of various data or information related to the family members. Then assessment of client's problem is the first phase or it is the initial assessment of the family assessment. So it is a part of the family assessment and this is the first step of the family assessment. It begins when a community health nurse contact with the client or family members for the initial home visit, that is first home visit. So it begins during the initial or first home visit. So the goal of initial home visit is to obtain a comprehensive clinical picture of the client's need and problems. So a comprehensive clinical picture of all the members of the family, their needs and their problems have to be identified during the initial home visit. So to collect or to obtain or to gather a comprehensive clinical picture of the family members' needs and problems are the goal of the initial home visit. Next is elements or components of family health assessment. Family health assessment includes 4 components. First one is establishing a good working relationship with the family members. Establishing a working relationship. Assessment of various health needs of the family members. Assessment of health problems of all the family members. And total assessment of the family. That is assessment of the families. That is their home, environment, etc. So the elements of family health assessment includes 4 elements or components such as establishing a working relationship, assessment of health needs, assessment of health problems, and assessment of total families. Let us explain about the elements or components of family health assessment. The first step of family nursing process. First is establishing a working relationship. The family and community health nurse should maintain a good working relationship to render the or to complete the nursing process, family nursing process. The family and the community health nurse has to maintain a good working relationship, good communication, good interaction and good interpersonal relationship. Then what is working relationship? Working relationship is a relationship which is maintained while working together by developing the trust, confidence and empathy. So it is a relationship between the family members and the community health nurse which is maintained while work together in relation to or in association with the family nursing process by developing trust each other, then maintaining the confidentiality of the problems or the topic and showing the empathy each other. So working relationship is a relationship which is maintained while working together by developing trust, confidentiality and empathy. Then working relationships are very essential. It is an essential component or elements to find out the fact or data or information from the family members and making correct decision to solve their problems and needs. So to find out the facts or data or information from the family members, the working relationship, a good working relationship is very essential. So it is the essential component or element to find out the data or information from family members that directly helps to solve the problems of the family and to promote the optimum health of the family members. That means a working relationship must have a scope of two-way communication from family members to community health nurse and community health nurse to family members. So it provides a scope of two-way communication. Then in this working relationship, the family members has to be given, they must be given equal opportunity as a community health nurse to give their own views, their ideas and express their own feelings and vice versa. So both family and community health nurse has equal opportunity to view the problem and share the ideas and express their feelings, for which the community health nurse must have enough interactions, communication or interpersonal relationship with the family members and to guide and help them to solve the problems. So through a working relationship or good working relationship, community health nurse must have enough interaction with the family members that helps to guide and help the family members to solve their own problems, to solve their own needs. This is about the establishing a good working relationship. The second component of family assessment is assessment of health needs of the family members. Assessment of health needs. So assessment is a continuous process. It is a continuous process which becomes more accurate as knowledge of people deepens. So as the people have more knowledge, we get more accurate information. So assessment is a continuous process which becomes more accurate as knowledge of people deepens or widens. Then assessment of health needs includes the gathering of 5 type of data, 5 different type of data. These data will generate the categories of health conditions, health problems, health needs of the family. So assessment of health needs includes a collection of 5 different types of data that helps to understand the health conditions and health problems of the family members. Let us see what are the 5 types of data could be assessed or gathered during assessment of health needs. So the 5 type of data includes first is family structure of the family, characteristics of the family and dynamics of the family. So family structure, family characteristics and family dynamics, changing concepts. Then second type of data is regarding socio-economic and cultural characteristics of the family. Socio-economic and cultural characteristics of the family. Third is home and environment, inside and outside the home of the family. Home and environment. Then fourth one is health status of each family members, that present and current and past health problems or health status of each family member. And last one is values and practices which family members follow on health promotion, maintenance and disease prevention. So what are the values and what are the healthy practices family members follow for the health promotion, for the promotion of their health, maintenance of health and disease prevention. So these are the 5 different type of data could be collected during assessment of health needs. So first is family structure, characteristics and dynamics of the family, socio-economic background of the family and cultural practice or characteristics of the family, home and environment of the family, that is inside the home and outside the home, that is their environment, health status of each family members, that is health needs and health problems, current and past, then values and practices that followed by the family members on health promotion, health maintenance and disease prevention in the family. Let us discuss in short about the 5 types of data. First is about the family structure, family characteristics and family dynamics. It includes the composition and demographic data of the members of the family or the household. So composition means how many males and how many females, the ratio of different gender. Then demographic data of the family members. The next is the relationship of the family members to the head of the family. So their relationship to the head of the family and place of residence, whether they are living in urban area, rural area, near to the health centers, etc. So place of residence, which place they belong, then type of the family, whether it's nuclear, joint, extended 3-generation family, etc. and size of the family, number of people in the family, that is 5, 4, 6, etc. Then family interaction or family communication within the family and to the neighborhood of the family. So family interaction and the family communication and decision making pattern in the family members, decision making pattern when the situation really comes, and group dynamics of the family. This all comes under family structure, family characteristics and family dynamics. Then second type of data related to socio-economic background and the cultural characteristics of the family, which includes occupation of the family members, place of their work, income of each family member, so income of each working member of the family, educational status of each family member, that is educational attainment, ethnic background of the family members, religious background of the family members, religious practice of the family members, then significant other people they related to the family and other roles the family members play in the family life. So other roles which are played by the family members in their family life and the relationship of the family to the community or to the society. How they maintain the relationship and socialization with the neighborhood, to the neighbors and to the society and to the community. So the relationship of the family to the larger community. This all information comes under socio-economic and cultural characteristics of the family. Next is regarding home and environment, which includes information on housing, type of housing, then sanitation facilities available in the house, then kind of their neighborhood, about their neighbors, facilities available in the neighborhood, then availability of social organization, health related organization or health institutions, so communication facility, transportation facility in that particular community. This all comes under home and environment. Then fourth one is health status of each family members, health status of each family member of the family, which includes current and past significant illness of the family members, that is present and past significant problem, health related problems of the family members, their beliefs, their practices, healthy practices or unhealthy practices which influence their health and illness, the nutritional and developmental status of each family members, especially for the under 5 children, nutritional status and milestones and developmental status, physical assessment of all the family members, that is physical assessment findings, then significant result of their laboratory report, diagnostic process, diagnostic test, screening procedures, what is available in the family. So significant result of the laboratory test they have been done in the various laboratories or diagnostic test they have been done in the institutions or screening procedure even which has been conducted by the community health nurse. These all includes the data comes under health status of each family member. The last one is values and practices of health promotion, health maintenance and disease prevention in the family. So which includes use of preventive health services. That is utilization of available health services from the community by the family members. Utilization of the Ayush or indigenous system of medicines, that is allopathy, Ayurveda, etc. So use of preventive health services. How the family members receive the preventive health services from the various health institutions from the community. Then adequacy of their rest periods, sleep hours, exercise pattern, exercise practices, other relaxation activities, then stress management of the family members, other healthy lifestyle activities of the family members. All comes under values and healthy practices on the health promotion, maintenance and disease prevention by the family members. Then it also include immunization status or immunization of the family members, especially the risk group of the family members such as under 5 children, pregnant ladies, etc. So this all comes under the information collected under values and practices, healthy practices of the family members for health promotion, health maintenance and disease prevention. So these are the 5 different type of data comes under assessment of the health needs of the family members. The next component of the family assessment is assessment of health problems of the family members. Assessment of the health problems. So health problems can be identified into 3 different categories. So according to Ruth Freeman, there are 3 types of health problems such as health deficits, health threats and foreseeable crisis points. Health deficits, health threats and foreseeable crisis points. These are the 3 type of health problems according to Ruth Freeman. Let us explain in short about these 3 categories of health problems. First type of the health problem is health deficits. Health deficits refers to the instances, some of the incidents of failure of health maintenance or health development by the family members. So when the family members fail to health maintenance and health development, that may lead to health deficits, which includes a diagnosed health problem of the family members, then suspected illness state of the family members. That is, family members are prone to have certain diseases according to their age, according to other diseases, etc. So diagnosed or suspected illness, then sudden death of the death in the family, premature death, untimely death, and any illness of the family members, any disability among family members, any amputation history of family members, etc. All comes under health deficit. Then failure to adapt to the reality of life by the family members. When the family members failure to accept or adapt or adjust to the real life, then that also lead to health deficit. Then emotional control. When the family members are failure to emotional control and maintain the stability, that all will lead to health deficits in the family. That is, deviations in the growth and development of the family members, personality disorders among the family members, etc. all comes under health deficit. So it is nothing but it refers to the instances of failure of the family members in health maintenance and health development. The second type of health problem according to Free Ruthman is health threats practices. Health threats practices. So health threats are nothing but it refers to the some conditions which predisposes to certain diseases, certain accidents, poor or retarded growth and development of the family members, any personality disorders among family members, and sometimes they may fail to realize their own health potentials and positive health practices or positive strength of the family members, all may lead to health threats. So the health problems which predispose to these conditions is called health threats. In short, health threat practices are poor healthy practices that may lead to some health issues of the family members. Some of the situations include for health threats are incomplete immunization among the children of the family members. So not complete immunization of the under 5 children in the family. Then environmental hazards in the family, that is insanitary living conditions, poverty in the family, family history of any chronic illness or non-communicable diseases such as diabetes, hypertension, etc. Family history of other hereditary diseases, faulty eating habits among the family members, faulty eating habits, unhealthy lifestyle, that is increased consumption of alcohol, smoking, etc. The lack of exercise, then threat of cross infection in the family, etc. These are some of the situations that may lead to health threats in the family. The third type of health problems according to Free Ruthman is foreseeable crisis or stresses which occur in the family. Foreseeable crisis point or stresses. Foreseeable crisis situation or stress points refers to the anticipated periods of unusual demands on the individual or the family members in terms of adjustment or family resources. So these are some of the situation or condition or states which occurs in the family. or some of the crises which occur during the different period of life in the family, such as pregnancy, retirement from the work, then stages of adolescence. So these are some of the developmental stages, some of the stress related periods in the family, such as when there is a pregnant lady in the family, then when a person is retired from the work, he may have some stress and tensions. Then adolescent, of course, they may have some stress and tensions. All these conditions are called as foreseeable crisis or stress. So it could happen in the family that the family members has to positively accept it. So as it is normal or common, these conditions are expected in the life of any individual or any family, but still family members may lead to various type of crisis in the family during such situations which occur in the family. Foreseeable crisis points or stress points includes marriage in the family, pregnancy in the family, parenthood in the family, divorce, any divorce in the family, loss of job, any family members, any death in the family, etc. These are the foreseeable crisis points or stress situation in the family which may occur as normal, but sometimes family members were failed to adjust or adapt with such a stress situation that may lead to a particular health problem is called as foreseeable crisis points or stresses. The fourth element of the family assessment is assessment of families. Assessment of families. Assessment of families includes assessment of environmental condition of the family, health status of all the family members, that is health status assessment, family health practices, various healthy practices of family members, so assessment of healthy practices of the family members and assessment of the family lifestyle. So assessment of family includes assessment of environmental condition, assessment of health status of the family members, family health practices, that is health practices of the different family members in the family, and the last one is family lifestyle. Let us discuss in short about the assessment of families. First is assessment of environmental condition of the family. So environment of the family home should be examined carefully by the community health nurse. That is type of house. Which type of house family belongs to? Pakka house, kacha house, tiled, terraced, etc. Then hygienic condition of the inside and outside the house. Then facilities available inside the house, then outside. Then safety measures or safety factors that they follow in the family. All comes under assessment of environmental condition. That is inside and outside the home, type of the house, hygienic or sanitary measures, facilities available for the healthy living practice, and safety measures for the protection of the health and promotion of the health of the family members. Second is health status assessment of all the family members, the complete health assessment of the family members, which includes physical and emotional health status assessment of all family members by using various available assessment tools or performers. One of the important point in health status assessment is each family member should be evaluated even if she or he is not a primary person to be cared in the family. Our concept is integrated health services, that is promotion, prevention, protection and restoration and maintenance. Thus, each family member should be evaluated even if she or he is not a primary person to care in the family, because we follow the integrated health services, that is promotion of the health, prevention of health, maintenance of the health, restoration and rehabilitation. Then, health status assessment includes name of the family members, age of the family members, sex, height, weight, immunization status of the family members, especially under 5 children and pregnant lady, and even adolescent, then developmental stages of the under 5 child, then past health history of the family members and current health history of the family members, etc. all comes under health status assessment of all the family members. The third component of assessment of families include family health practices or healthy practices of the family. So family health practices. So finding out the practices, healthy practices of the family members toward healthy living of nutritional status, sleeping pattern, their exercise programs, regular exercise programs, rest, habit of alcoholism, smoking, use of health facilities available in their areas like Ayush and other, utilization of allopathic health institution services, etc. The type of health services they are utilized, or the way in which the family use different health resources in the community, and the utilization of the different providers in the community, all give information about the health of the family members. That will make a community health nurse aware of their healthy practices, that is healthy practices among the family members, that indirectly give a clue for the strength and weakness of the different family members. This is about family health practices. The next component of family assessment is family lifestyle, that is to identify the lifestyle of the family members. Family lifestyle includes observation and description of the family's interrelationship. So relationship among the or between the family members and their communication pattern or communication flow between the family members and with the others, which includes identification of the role of each family members in the family. So identification of role of each family members in the family, pattern of decision making in the family in relation to health and other process in the family, then family's attitude towards the health care, whether they have positive attitudes, whether they do early detection of the problems in the family or no, whether they utilize the maximum available resources in the family. That is about the family's attitude towards the utilization of various healthcare services. All comes under family lifestyle. Then family assessment also includes the assessment of the health risk families. There are a few families in the community. Of course, they are the risk families. So assessment of health risk families. Health risk families are those families who experience a particular event or other events of any disease repeatedly occur in the family that make them more prone towards physical, psychological and environmental responses. So health risk families are nothing but they are the families who experience a particular problem in the family, such as event or other problems or other events of any diseases which occurs repeatedly or continuously that make them more prone towards a problem with physical, psychological and environmental. Such families are called health risk families. Let us see how to assess the health risk families. Assessment of health risk families include, or it is done through the scrutinization of the health records of the family members, details of their clinic or health center visit, the register from the health centers or health clinics, then direct observation of the family members and physical health assessment of the family members. So these are the some of the tool which is used to assess the health risk families, such as health records or reports, that is health records or family folders of that particular family. Then details of the visit of clinics and health centers for the regular services, then observation and physical health assessment of the each family members. The next session is the steps of family assessment. There are mainly three important steps in family assessment that includes data collection, data analysis, problem statement or formulation of family nursing diagnosis. So steps of family assessment includes data collection, data analysis, problem statement or formulation of family nursing diagnosis. Let us discuss in detail about the steps of family assessment. So first step is data collection. Data collection is a systematic approach to gather or collect the information from the family members to get a complete or accurate picture of the health status, health problems or health needs of the family members. So data collection is a systematic process or systematic approach to collect the information or collect the data from the family members to get the complete and accurate picture or information of health status of the family members, which includes subjective data and objective data. Subjective data are the information which collected from the family members. Objective data are the information which collected by the community health nurse through her observation and interview or health assessment. So there are two types of data, that is subjective data and objective data, which collected during data collection period from the family. So in relation to data collection, during the initial home visit, the community health nurse or home health nurse obtain certain information from the family members, such as health history of the family, that is health history from each member of the family, that is their current problems and significant past health history of each family members. Then conduct an health assessment of all family members. Then observe the relationship of the family members and the caregivers in the family. Then assess the home, that is inside and outside. Then assess the community or society where they belongs. So during the initial home visit, community health nurse collect certain information, obtain certain information from the family. That is, one is health history of the particular family, health assessment of all the family members. Then observation of the relationship between the family members and their caregiver. Then assess the inside and outside the home of that particular family and assess the community or society, environment and facilities available for that particular family. The parameters of assessment of home environment also include client and caregiver mobility, mobilization of the client and caregiver in the family, then ability of the family members to perform the self-care. So how many of the family members can perform the self-care, then cleanliness of the inside and outside the home, that is the environment of the family, then availability of the caregiver support to the family, and safety precautions following by the family, food preparation, hygienic preparation of the family, financial support of the family or financial background of the family, then emotional status of the family members, that is both the client and caregiver, etc. all comes under of data collection as parameters of assessment of home environment during initial home visit by the community health nurse. The next is approaches or methods of data collections. So the data is collected from the family members by using various methods or approaches, which includes meet with the family with the family profile format, then observation method both inside and outside the home, then interview with the family members, physical examination or health assessment of the family members, then reviewing the various record present in the family in relation to their past healthcare services, for example lab reports of the family members, then making a case study or taking a case in the particular family and rendering the care and evaluating the care, then other methods. So these are the some of the approaches or methods to collect the data from the family. So meeting with the family, that is through family profile, observation, interview, physical examination or health assessment of the family members, record review method, case study and other methods. So these are the methods or approaches to collect the data from the family. The second step of family assessment is data analysis. Whatever data we have collected, information we have collected from the family members is called raw data. Again, it has to be analyzed and go through in detail to make a specific information. So data analysis is a process of extracting the raw data for the purpose of obtaining constructive information, specific information about the family members that can be applied for formulating various or making various family nursing diagnosis. So whatever collected information from the family members is considered as a raw data. So data analysis is a process of extracting the raw data for the purpose of obtaining the constructive or specific information about the family or family members that can be applied later. It can be applied to formulate the family nursing, specific family nursing diagnosis. Data analysis also includes specification of the problem as actual problems and potential problems. Actual problems are the problems of the family members that is present at the time of the assessment by the community health nurse. Potential problems are the problems for which the family members are high risk, that is not at present but that may occur in the future. So potential problems for which a client has high risk may occur in the future. Potential problem may be either related to the disease condition of the particular family member or according to his age. So data analysis ends with the specification of the problems such as actual problems and potential problems. So during data analysis, we can prepare a format such as a family needs and problem identification format, that is needs and problems with a priority list. Priority can be given in the next element of the family nursing process that can be added later, but we can collect the problems and needs of the family members with this particular chart. So it includes a serial number, name of the family, age, classification of the family members, problems such as actual problem and potential problem, need such as specific need and general need. Then later you can add the priority or ranking column. So name of the family members from head of the family we can start. Then is age we can write. Then classification, that is head of the family. Classification is the relationship with the head of the family to other family members. So you can write wife, son, etc. Then problem, actual problem are the problem that a community health nurse observed during the visit. Potential problem is the problem which occur in the future in relation to the age of the particular family member or according to his disease condition. Then need, general need and specific need. General need for all the family members. Then specific need is according to the age, according to sex of the and according to the disease condition of the particular person, there will be a specific need. So under 5 children, specific need is the immunization. So complete the all the vaccines of under 5 children, that comes under specific need of the under 5 child. Antenatal mother, that is specific need is antenatal checkup, antenatal assessment, antenatal advice, etc. Generally regarding the water, regarding sanitation, prevention of vector-borne diseases, waterborne diseases, etc. Then priority or ranking can be given in the next element of the family nursing process during the planning stage or planning phase or planning step. That is about the identification of family needs and problems. The second element of the family nursing process is family diagnosis, making family diagnosis. which includes a problem statement. So once the problem identified through the data analysis. So after data analysis, we'll get the specific problem of the family members that has to be stated in a diagnostic statement as a diagnosis. That is called nursing diagnosis. Nursing diagnosis is a clinical judgment about the individual or family member responses to his actual and potential problems. So nursing diagnosis is a clinical judgment about individual or family responses to or towards actual or potential problems. Nursing diagnosis usually has three parts, that is PAS or PES. First, it includes first part of the nursing diagnosis may include a description of the problem. So problem of the particular family member, then identification of the factors or etiology for that particular problem. So etiology related to the problem, that is E, or you can write etiology AE, that is, so that comes under A. Then last one is signs and symptoms of the particular problem, signs and symptoms that characterize the particular problem. So nursing diagnosis has three parts, that is PAS, problem, etiology and signs and symptoms. For example, poor nutritional status of the under 5 child in the family related to knowledge deficit regarding the weaning diet, because weaning has to be started at 6 months. So knowledge deficit of the mother of the under 5 child regarding weaning diet, that is evidenced by growth monitoring chart. So the weight of the child will become less than the normal when compared to the same age of the other child. So that usually comes under the normal curving of the growth chart. So after collection and analysis, we make a diagnosis. So diagnosis of health needs and health problems of the family from interpretation of the collected data. This diagnosis is called family diagnosis. So when we do nursing diagnosis in the family, we call it as a family diagnosis. When we do in the community, we call it as a community diagnosis. Otherwise, we call it as individual diagnosis. So diagnosis of health needs and health problems of the family from interpreting the collected data or information from the family members that is already received during the assessment phase or assessment step. Then examples of common family nursing diagnosis for home care includes deficient knowledge of the family member, impaired home maintenance by the family, risk for caregiver in the family, and role strain. When the role changes, family members may have stress, that is a role strain. So these are some of the examples for the family nursing diagnosis. Family diagnosis can write according to the latest version of the Nanda nursing diagnosis. Then third elements of family nursing process is planning for nursing action. That is planning of client care or client's care for nursing action is the third element of the family nursing process. Let us discuss in detail about the planning for nursing action. In short, that is called family health planning. Family health planning is a systematic process which involves logical decision making at each step of its process. So family health planning or intervention is a process. In each step of its process, it uses logical decision making. So it is a systematic process which involves logical or intelligent decision making at each step of its process. That is family health action plan process. Family health planning is directly based on the family diagnosis. So family health planning is purely or directly based on the or in relation to family nursing diagnosis. Purpose of family health planning includes to determine the course of actions according to the needs and problems of the family members, to meet the health needs of all family members, and to resolve or solve the health problems of the family members, thus to promote the health of the family members. So purpose of family health planning includes to determine the course of various actions or services to render to the family members, then to meet the health needs of the family members, and to resolve the health problems of the family members in total. The steps of family health planning includes analysis of diagnosed health problems, establishing priorities, setting goals and objectives, and formulation of various family action plans. So there are 4 steps in family health planning. First one is analysis of diagnosed health problems. So already we have made family nursing diagnosis. Once again it has to be final analysis, that is analysis of diagnosed health problems. Then setting priorities, that is establishing priorities among the diagnosed health problems. Then setting goals and objectives. The last step is formulation of various family action plans. Family action plans. Let us discuss in detail about the steps of family health planning. First step is analysis of diagnosed health problems. Analysis of diagnosed health problems is done to clarify the nature and the extent of the problem. Once again, to make sure the nature and the extent of the particular problem, that is nursing, family nursing diagnosis, we do analysis of diagnosed health problems. So all the data we have collected from the initial home visit. So here, after analysis of diagnosed health problems, sometimes it may require further collection of some specific information from the family members, that is known as second level assessment. So analysis of diagnosed health problems may lead to second level assessment to clarify the nature and the extent of the final family nursing diagnosis or statement of the problems. So during analysis of diagnosed health problem, the health problems again classified into different categories such as life-threatening problems, actual problems, potential problems, preventable problems, etc. So all problems of the family members or family nursing diagnosis again classified during the analysis of diagnosed health problems in the family health action phase. First step, the health problems which are collected are categorized into life-threatening problems, actual problems, potential problems and preventable problems. Then second step is establishing priorities among the various health problems or family nursing diagnosis. That is establishing priorities. That is nothing but refers to ranking the health problems. So we have already prepared a chart. In the chart at the end we can give one more column. There we can write a ranking or a priority. So list of priorities. So establishing priorities refers to the ranking of all the health problems which has to be treated first and which has to be treated later. It is necessary because of the limited resources of man, money, material available in the family nursing services. So establishing priorities among the family nursing diagnosis are necessary because of the limited resources available to render the health services to the particular family. So there are set criteria for ranking the health problems of the family members, such as the first criteria, type of health problems, second is extent of the problems, then severity of the consequence of the particular problem, salient feature of the problem, that is salience, preventive potential of the particular problem, and modifiability of the problem. So there are 6 criteria for ranking the problems. First one is type of health problems. So which type of health problems? So as we have already discussed the type of the health problem, according to Ruth Freeman, problem can be divided into health deficits, health threats, and foreseeable crisis points or foreseeable stress. So this we have already discussed in detail. So the ranking will be given according to the type of the problem, whether it belongs to health deficit, whether it belongs to health threat, or whether it is a foreseeable crisis of the family. Then extent of the problem. How many of the family members are suffering with that particular problem? The extent of the problem. Then how long it continues. Then severity of the consequence or complication of that particular problem. That is severity of the consequence of the problem. Then salience. Salience is nothing but the perception of the family members for the significance of or need of this particular problem to be dealt during the community health nursing process. So salient feature is nothing but it refers to the family's perception and evaluation of the particular problem in terms of its seriousness and urgency to be attended. So urgency of attention needed. So family's perception and evaluation of a particular problem is called salience. Then preventive potential, whether the problem can be prevented in future. So preventive potential. Then modifiability of the problem, whether the problem can be modified later. So these are the 6 criteria for ranking problems. That is type of health problems, extent of the problems, severity of the consequence of the problem, salient feature of the problem, that is salience, preventive potential of the problem, and modifiability of the problem. The third step of family health planning is setting goals and objectives. So first is goals. Goal is a name which describe the desired changes, which explain the what will be the desired changes at the end, or the outcome of the family health nursing services to achieve at the end. So goal is a name which describe the desired changes or outcomes to achieve at the end. That will be evaluated at the end of the nursing process, that is family nursing process. Then goals are directly refers to the family diagnosis. So goals are belongs to or depends upon the family nursing diagnosis. There are 2 types of goals, that is short-term goals and long-term goals. Short-term goals and long-term goals. The example of short-term goal is reduce the temperature to the normal. So if the family member is suffering from fever, the short-term goal is to reduction of temperature, reducing the temperature to the normal body temperature. But this rise of temperature or fever may be a sign of infection. So the long-term goal is prevention of that specific infection. So goals include short-term goal and long-term goal. Short-term goals to be achieved immediately and long-term goals achieved at the end of the complete family nursing process. Then about the objectives. After setting the goal, next is objectives, making objectives. Objectives are specific actions and measurable steps. So it is a measurable steps to achieve a particular goal. So it is the objectives are the specific actions and measurable steps to achieve the goal at the end. Characteristics of a good objectives always follow SMART. S-M-A-R-T. S stands for specific, M stands for measurable, A stands for achievable, R stands for relevant, and T stands for time bound. So specific means it has to set with certain targets that has to be completed, that has to be fulfilled at the end. Then measurable, the result of the services or rendered services or nursing process has to be measurable. Then A stands for achievable. So objective has to be achievable within the available resources. It can be solved with the available resources. R stands for relevant. It should be significant, relevant, or important. Then time bound. So objective has to be achieved within the specific time or specified time period. So this is about SMART. The last step of the family health plan is formulation of family action plans for various interventions. So formulation of family action plans refers to the identification of appropriate or effective family health nursing interventions. So strategies, family health nursing interventions or strategies, and preparing an operational plan. It is a plan. Preparing an operational or working plan to be implemented to achieve the established set goals and objectives. We have already set goals and objectives for the particular nursing diagnosis. So formulation of family action plans refers to the identification of appropriate and effective family health nursing interventions or strategies. So that is family health nursing services, and preparing an operational plan, working plan with the nursing care plan to be implemented to achieve the established goals and objectives what we have already set. At the end of the family health plans, we formulate the various family action plans to be rendered to the family to resolve the problems of the family and thus to promote the health of the family members. Like community participatory approach, planning with the family also very important. So we call it as a family participatory approach. So all the services has to be planned and implemented during family nursing process with the family participatory approach. That is nothing but making and listing out the various action plans or health services or health care with the family participations. So family will be participated during planning and during implementation and even during evaluations. So during the planning phase, the community health nurse needs to encourage and permit the family members to make their own health management decisions and their own health views to resolve the particular problems of that particular family. So planning with the family is an important process in this step, that is family participatory approach to promote the health of the family members. The fourth element of family nursing process is action phase or implementation of family health nursing process. That is implementation of family health nursing process. So let us discuss in detail about the action phase of family health nursing process. It includes the implementation of the action plans. So implementation is nothing but which refers to the putting the plans, action plans into or putting the plans into actions to achieve the set objectives and goals of family health nursing process. So implementation is nothing but which refers to the putting the plans into actions to achieve the objectives and goals which already set in advance of family health nursing process. Then implementation is done by the family health nursing service. So rendering various family health nursing care or family health nursing services, we do the implementations. So it is done by the rendering of various family health nursing services to the family members. In this implementation phase also, we need a complete cooperation and participation from the family members. So implementation needs cooperation and participation from family members or from family. According to Ruth Freeman, there are three types of nursing interventions to be implemented, that is based on the actions. According to Ruth Freeman, there are three types of nursing interventions, that is supplemental, facilitative and developmental. Supplemental, facilitative and developmental. Let us discuss in short about the three types of nursing interventions to be implemented during the implementation or action phase. So first type is supplemental interventions. That is doing the things for the families. Here community health nurse do the activities or services. That is doing the things for the family members which they are unable to do or not able to do. That is concerned supplementing the interventions or actions. Second intervention is facilitative interventions. That is setting provision for facilities to the family members. That is help the families to mobilize and develop their own resources and do the actions. So facilitative interventions nothing but providing facility for the family members and making them to do the activity self-care activities. Then third one is developmental interventions. So help the families to develop and improve their capacities. It includes a demonstration of the various procedures to the family members and supervision of their self-care activities. Family members return demonstration or self-care activities, thus developing the self-care abilities among the family members. That comes under developmental intervention. So there are three types of interventions: supplemental, facilitative and developmental interventions. Then intervention can also be classified as dependent interventions, independent intervention and collaborative interventions. Let us see what is the difference between these three. Dependent interventions means here community health nurse and another health care provider render the family nursing services to the family. That is dependent intervention. Independent intervention is nothing but community health nurse alone who render the services to the family member. That is called as independent intervention. Then collaborative intervention is nothing but intervention is done by the whole health team members of that particular area. Usually collaborative interventions are done in the community nursing process. So collaborative intervention specially applied in community nursing process. In family nursing process we have both dependent interventions and independent interventions. So these are the three classification of interventions such as dependent, independent and collaborative interventions. Next is steps of implementation. There are 5 steps in implementation. First one is review of overall plan and understand the plan. Understand it. Review of overall plan and understand it. Second is mobilization of the available resources to render the family nursing services. Mobilization of or collection of available resources or setting of available resources. Then establishing good working relationship with family members. Establishing good working relationship with the family members and other health team members. Then implementation of the health services. Then after the implementation, documentation and recording of the various family nursing services or cares. So let us discuss in short about the steps of implementation. So first step is review the overall plan and understand the various strategies which is already planned and the schedule which already planned or prepared. That is what, when, how, who. What are the services to be given, when it has to be given and how it has to be given and who are the people it has to render. So review overall plan and understand the strategy and the schedule of the implementation. That is what, when, how, who. Then mobilization of the available resources for the family nursing process. So collection of the resources. Then establishing working relationship with the family and their active participation. That means establishing a good working relationship with the family members and gathering the active participation of the family members in relation to during the implementation of family nursing services. Then after that implementation. It can be implemented as it is already planned or it can be modified according to the situation. So as it is or modified implementation. After the implementation, next step is documentation. Documentation includes recording of all the interventions already implemented, then progress made through implementation, then any difficulties faced during the implementation and any constraints encountered during the period of implementation. All has to be recorded in documentation. So next is evaluation of the program. The last and the 5th elements of family nursing process is evaluations. Let us discuss in short about the evaluation of the family health nursing process. So evaluation is usually the final step of the nursing process. So it is the last step of the nursing process which involves determining or finding out whether the goals already set have been met, partially met or not been met. So we have already set the goals and objectives for the family nursing process. At the end of the process during the phase evaluation step, it will be determined whether the goals, set goals have been met, have been partially met, that is 50%, then have not been met, That is, no goals are achieved at the end of the family nursing process. Then evaluation, usually though it is a final step, it has to be done at each step of nursing process, such as assessment, planning, implementation, and even in evaluation. Then evaluation helps to modify the services if necessary at the end as the continuation of the reassessment, and again we start the family nursing process. So it helps for modification of the family nursing services if necessary, and a reassessment should be done after the evaluation to continue the family nursing process. As it is a process, it is a cycle. So reassessment should be done after the evaluation phase. Next is meaning or definition of evaluation. Evaluation is a systematic process. So nursing process itself is a scientific process. So it is a systematic process of determining or finding out or understanding the extent to which the objectives are achieved or set goals are achieved. So extent, how much, how far we have achieved the objectives or goals. So a systematic process of determining the extent to which objectives are achieved. It has got two parts. So evaluation is a systematic process which consists of two parts. First part is identification of the goals and the objectives towards which the nursing process is aimed. Family nursing process is aimed. The second part includes the judgment of whether these goals or objectives are being achieved or not. Thus, evaluation consists of two-part, that is two-part process, first part and second part. The first part is setting the goals and objectives. Second part is the judgment whether the goals and objectives are achieved or fulfilled or not. The two most significant types of evaluation is formative or concurrent evaluation, summative or terminal evaluation. As the term indicates, formative or concurrent means the evaluation has been done during the process of activities. Summative or terminal evaluation, it has been done at the end of the complete actions or programs. Thus, formative or concurrent evaluation includes evaluation of the resources, man, money, material, that is called a structure evaluation, and evaluation of the nursing process activities, that is process evaluation. Then summative or terminal evaluation usually done at the end of the family nursing process. It is done at the end of the determined period with set goals and objectives, so with certain criteria. It is also known as outcome evaluation. Summative or terminal evaluation is also known as outcome evaluation. Next is the steps of evaluation. There are mainly 5 steps in evaluation. The first step of evaluation is determine or find out or understand what is to be evaluated, which goals or which objective has to be evaluated. Then establishment of standards and criteria for this evaluation. So set certain standards and criteria for the evaluation process. Then third step is planning the methodology. So plan the different methods of evaluations. Then through these methods, fourth step is gathering the information or data regarding the success of the particular action plan. So gathering information or data, and final at the end, the fifth step is analysis of the results or information which is already gathered. So analysis of the results of implementation. So these are the 5 steps of evaluations, which includes determine what is to be evaluated, establishment of specific standards and criteria, planning the methodology for evaluation, gathering the information or data, and analysis the data or the results. The next is the tool for evaluation. So evaluation will be done with the various tools such as direct observation by the community health nurse to the family members, then questioning the family members or through interview, then reviewing the records of the family members, that is a record review, and with the other methods or other tools for evaluation. In short, evaluation is not an end of the family health care or family nursing process or program. It is a continuous process. We have to continue after evaluation as a reassessment, and we have to restart the family nursing process. So, evaluation is not an end to family health care program. It is continuing process integrated with the other phases like reassessment, replanning, and implementation. The ultimate goal of the community health nurse in family health nursing process is to make the family to have the self-care abilities, self-supporting the family problems and needs, independent decision making, and independent identification of the presence or absence of preventive health behavior among the family members. Then to have a skills in determining or identifying various strategies when there is a problems and needs, and using appropriate resources to meet their own needs, demands, and various health problems, thus to have an optimum family health. So thanks for watching. Hope this video really benefits in your studies and exams. If you feel it is worth and beneficial, please like, share, and subscribe my channel, and stay tuned with the Angel Health Academy for the next community video. Thank you.